Hey, my name is Dr. Jason Strandberg. I'm the medical director at Lake Minnetonka Mobile Wellness, and today we're going to talk a little bit about peripheral neuropathy. Now, peripheral neuropathy basically is the damage to peripheral nerves that typically causes weakness, numbness, pain, and other symptoms in the hands and feet. It can affect other areas of the body, including the digestive, the urinary, the circulatory, and the reproductive systems, but we're going to focus mostly on the hands and feet because that's typically what we see in clinical settings. And this is a picture here of diabetic neuropathy. Neuropathy, according to Taber's Medical Dictionary, is any syndrome in which muscle weakness, paresthesia, impaired reflexes, and autonomic symptoms in the hands and feet are common. So if you look at this image, this is showing you how the nerve supply gets to the feet, mostly from the sciatic nerve down the back of the leg, and that branches off into the tibial nerve and the sural nerve. And then you can see down the back side here, the tibial nerve branches into median calcaneal, lateral plantar, medial plantar nerves, and all of these different branches. And if any of these is affected, you're going to get specific symptoms in those areas. Now, signs of peripheral neuropathy will vary depending on which nerves are affected. But again, looking at the ones that we're primarily looking at, hands and feet, there's a gradual onset of numbness, prickling, tingling in your hands, your feet that seem to spread towards the arms or legs. And then at the very beginning, they'll feel like you have socks or gloves that are on your feet when you don't, and then slowly they'll become number and then eventually more painful, and in some cases even extremely sensitive to touch. Paralysis is possible if motor nerves are affected. Lack of coordination, falling, not being aware of when you stepped on something. These are all signs of peripheral neuropathy. Now the causes are varied. The most common cause is diabetes mellitus, and if that is not controlled, that actually damages the blood vessels that go to the nerves in your hands and feet, which is why that you have loss of sensation. Other common causes could be nerve entrapment syndromes around the elbow or the knee, alcoholism, thyroid problems, medication or other environmental toxins, certain infections like the chickenpox or herpes family can cause peripheral neuropathies. Cancers and bone marrow disorders like leukemia and multiple myeloma can cause peripheral neuropathy, as can the treatment of certain cancers. Vitamin deficiencies, especially the B family and vitamin E, can lead to peripheral neuropathies. And kidney and liver failure can also cause peripheral neuropathy. Now, the diagnosis of peripheral neuropathy is mostly done with the history and physical examination. We ask you the questions. Have you noticed this? When did it come on? How is it affecting your life? What are the things that you can not do now that you could do before? And then discuss the symptoms, discuss other things going on. We will often do blood tests to rule out things like diabetes or thyroid problems, and then maybe even do some nerve function tests or diagnostic imaging, but mostly we diagnose this with history and physical examination. Now, the treatment methods for peripheral neuropathy are varied. If you have diabetes or some other metabolic disorder, you treat that disorder first. And then we look at the other symptoms. Anti-inflammatory medications are very, very effective, typically ibuprofen or naproxen. We might do some rehabilitation or some occupational therapy to get you used to the lack of sensation. We will want to look at your feet more frequently to make sure that you don't have a cut or a wound in there that becomes infected and causes a much bigger problem down the road. There are exercises and stretches that we can do to help. Cold laser seems to be very, very effective at reestablishing blood supply to those nerves, as does acupuncture. And then a more recent thing that we're starting to see is the use of extracorporeal shockwave therapy to treat this, especially when an entrapment syndrome or something trapping the peripheral nerves in the legs or forearms is causing the neuropathy. Now, if these treatments don't work, then quite often we move on to anti-seizure medicines like gabapentin or antidepressants like Lyrica, and quite often they will be helpful as well. The prognosis for peripheral neuropathy. If treated appropriately, in our clinic, we tend to see about 80% improvement in 2 months or so. Now, especially if this is due to a metabolic problem like diabetes, you're probably going to require maintenance treatment, like one treatment a month or every couple of weeks, to keep yourself at that 80% improvement. If you're not treating this, eventually you're going to potentially lead to a setup where you can't feel anything anymore, and your skin can be damaged. You can have a puncture wound, you can have scrapes and cuts that don't heal, and eventually bacteria gets into them. Burns could also happen without you even noticing. And all of these could lead to an infection and gas gangrene, which eventually can even lead to amputation. Now, another problem that we see in people with peripheral neuropathy, especially older patients, is that the weakness and the loss of sensation combined make it a whole lot easier for them to fall and hurt themselves. Now, Lake Minnetonka Mobile Wellness, we are a multidisciplinary medical group. We are focused on improving your health, your performance, your well-being. We have chiropractic, acupuncture, primary care and anti-aging medicine, rehabilitation services, massage, personal training, and we bring that all to your home or to your work. We do treat peripheral neuropathy, like I said, with large success. Most of our patients notice an 80% improvement within about 2 months' time and are able to significantly improve their life. So if you are interested in learning more about peripheral neuropathy or how we can help you at Lake Minnetonka Mobile Wellness, please give us a call at 952-222-7886 or find us online at lakeminnetonkamobile.wellness.com.